All right, so good evening, everybody. We are going to go through chapter 10, which is the muscular system. So the reason why I'm going through the muscular system today is because because you'll be doing a lab on muscles next week, and we want to get you prepared for that. Okay, so when we talk about muscles, oh, come on, get out of the way. All right. What are the four primary tissues? You know it. Epithelium, connective tissue, nervous tissue, and muscular tissue. So muscular tissue is a primary tissue. Okay. And what's the function? What does muscles do? They contract, which means it causes movement in the body. So movement is what muscles do. And again, there are three types of muscles. We learned that in the lab. What are they? Skeletal muscle, smooth muscle, and what's the third type? Cardiac muscle, correct. So which is the most common muscle in your body out of the three? Skeletal muscle, exactly. You see skeletal muscle everywhere. Where do you see the cardiac muscle? Only in the heart. And where do you see the smooth muscle? Blood vessels. Blood vessels have smooth muscle. And where else? Digestive tract. Why do you need muscles in the digestive tract? To break down the food or to move the food? To move the food. How does that happen? Peristalsis. So peristalsis is there's a contraction happening. Imagine there's a tube. Okay, there's a contraction happening at the top. This part is not contracting, so the food enters into the second part. That part contracts. It goes into the third part. It keeps moving. So it's pushing food down. It's moving food. So movement is just not when you're walking or running. It's happening all the time. So that's what's happening with the smooth muscle. And do you control it? No, you don't know. It's happening. So what do you call that kind of a muscle? Involuntary. Okay. So you have a voluntary muscle and you have a involuntary muscle. So let's summarize. What's the function of the muscle? Movement is the first thing, okay? And what's the other thing? Balance. Now you're sitting, you think you're not moving, but your muscles are keeping you upright, right? So it's balancing your body. Control of openings. What does that mean? We all have openings in the body. There's a fecal opening, there's a urinary opening. They're all controlled. What kind of a muscle are they, which is controlling your? They are, well, actually, what I meant is it's a circular muscle. It's controlling your opening urinary passage. It's a sphincter muscle, exactly. Sphincter means it's a circular muscle, correct. Again, muscles, they produce heat. So your body has to keep its temperature. And heat production is a main function of the muscle. And one last thing is glycemic control. What do you mean by glycemic control? Your blood sugar control. So we have to keep our blood sugar under control, right? If you don't control your blood sugar, what happens? What's the disease when your blood sugar shoots up? Diabetes, correct. Diabetes is a bad disease. It's a very bad disease. It's a chronic disease which affects all the organs. And diabetes is something which happens when the blood sugar shoots up. Okay, so there may be many reasons for it, but the important thing is to make sure that it is brought down. The blood sugar has to be brought down to normal levels. How do you do that? You have insulin and all those things happening. Say, leave all those things. The muscles play a big role. They utilize a lot of that blood sugar and bring it down. So the blood level goes down when your muscles are active. That's why we tell you to exercise. So when you exercise, your muscles are breaking down blood sugar, taking the sugar in. And what happens? The sugar is converted into ATP. And then what happens to the ATP? It's used by the muscle for movement. And we're going to learn how that is going to happen later, probably next week. So that is the glycemic control. Okay, so I told you there's about 600 skeletal muscles, and you're going to learn about 150 of them. And next week, the labs are starting, and you're going to see a lot of models in the lab with muscles. And that's why I'm taking you through the muscles today. Okay, so I told you that muscles are specialized to convert ATP into mechanical energy, into movement, okay? So now we're going to look at the structure. How is a muscle organized? So when you think about a muscle, what happened? When you think about a muscle, let's look at the smallest part of the muscle, which is called a muscle fiber. We're talking about this tiny little thingy here, this little thing here, not the whole thing, the one single muscle fiber, which is a muscle cell. That's a cell of a muscle. It's called a muscle fiber, okay? This muscle fiber, and there are thousands of muscle fibers in a muscle. So let's look at the smallest structure, which is a muscle fiber. That muscle fiber is surrounded by a wrapping, and that wrapping is called the endomysium. Endomysium. Okay, so you have this tiny little muscle fiber here, and it's wrapped around by the endomysium. And then there are bundles of muscle fibers together, and it forms a fascicle. Okay, and this fascicle is again wrapped around by a membrane, and that membrane is called the perimysium. And then there are multiple fascicles. They come together, and that forms the muscle. So when you say your biceps, you have a lot of fascicles inside it, okay? And the whole muscle is again wrapped. So it's a constant wrapping. So the whole muscle is wrapped by the epimysium. So you have to learn these terms: endomysium, perimysium, epimysium, fascicles. Okay, these terms are important. And so you have a muscle, say the biceps. This is the biceps here. So that is covered by the epimysium. And then there's another group at the back of the hand. What do you have? Triceps. So you have the biceps here, you have the triceps at the back. Your opposing muscles, right? And so there are different muscle groups. Now, the different muscle groups are separated by what is known as the fascia. Okay, so we have introduced a lot of new terms here. So I want you to get familiar with these terms. So let's quickly look at the shape of the muscles. So if you look at the biceps, it is a fusiform muscle, like a spindle. If you look at your rectus, the abs, that's the muscle in the tummy, the abdominal muscles. The abs, if you have a if you're doing a lot of exercise there, you can develop a six-pack, right? Okay, so that's and I'll tell you why the six-pack is happening. Then you can have so that'll be a parallel muscle. You can have a triangular muscle, which is a pec major, pectoralis, which is a muscle on your chest, anterior chest. And then you can have a unipennate, which is muscle, the fibers are on one side of the tendon. And if it's on both sides, it's bipennate. And if it is in different directions, there are multiple rows. We call it multipennate. Deltoid is one of them. And the circular muscle, which is a sphincter muscle. We talked about that. So there are different types of muscle in the body. Okay. Now, muscle compartments. Muscle compartment means there is a group of muscle which is functionally related. They're all doing the same job. For example, what are the movements here of your arm? What is this called? Coming close to flexion. And what is this? Extension. So flexors, these are the flexors. These are the extensors. So you have a group of muscle which is functionally related. And I told you the muscle groups which have the same function are enclosed in the fascia. And the reason why it's enclosed in the fascia is because those muscles are performing a particular function, and there's a nerve which supplies it, which causes that muscle to contract. So for example, you want to lift something up, which muscle are you going to use? The biceps, okay? If the triceps starts contracting at the same time, it will be opposing it. So that means the nerve, which is supplying the flexor or the flexor nerve, should be activated. The extensor nerve should not be activated at that time. That's why we have the muscle compartments, so that there is a nerve supply, there's a blood supply for that particular muscle group. So nature has done it very well. It's beautifully organized, okay? So we're going to look into that organization now. Again, let's have a quick look, the attachment of muscle. So muscle is attached somewhere, right? It has to be, mostly it is attached to where? The bone, because muscle causes movement. And how does it attach to bone? Does it just go and hit the bone? No. How does it attach? Through a tendon, okay? We learned the tendon in the histology class, the structure of the tendon. So the muscle attaches to bone through the tendon. So if it doesn't attach directly to bone, we call this an indirect attachment. And what really happens now, I'm going to explain the importance of those wrappings. So I said there's a wrapping around the muscle fiber, and all these fibers are together called a fascicle, and there's a wrapping around it. And all the fascicles are together, and there's a muscle, and there's a wrapping around it. All these wrappings will be going into the tendon. So when the muscle contracts, and that tendon is attached to the bone. So when the muscle contracts, all these wrappings are there, so it will not detach. So that's the whole purpose of all these wrappings. So the force generated by the muscle fiber is transmitted all the way to the bone. So inside the bone, the outside of the bone is covered by what? Periosteum. And from the periosteum, there are fibers going into the bone. What do you call that? Sharpie's fibers or perforating fibers. And these fibers go into the axons. Axons are the functional units of bone. and we learned that in the lab, the axon, the structure of bone. You have a central canal, you have lamellae, the lamellae around it, and then you have the little connections, canaliculi, right? And you have osteocytes, and you have lacunae, small spaces, all those things you learned in the lab. So I want to put everything into the right perspective so you know what you're learning and why you're learning it. So we learned a lot of things in the lab. Now we're going to put everything into practice. Okay, so that's the importance of all these wrappings and how muscle movement, how muscles contracts and how it produces movement. So again, there's another type of muscle attachment called the direct attachment. This is really not seen in many places, but if you look at one of the main muscle, there's a big muscle here on the side of your head called the temporalis that directly attaches to bone. It's called a fleshy attachment. So this is there's only a few muscles which have this direct attachment, and temporalis is one of them. Again, now I'm going to talk about two types called intrinsic muscle and extrinsic muscle. It's very simple. Intrinsic means a muscle is within a region. For example, the palm of your hand, you have muscles here, and the action is in that area. So you want to flex the fingers or everything, these muscles in the palm does it. So that's an intrinsic muscle. Whereas an extrinsic muscle is when the muscle is attached elsewhere. So you have a forearm muscle, which causes flexion, but it also causes finger flexion. So the muscle is here, but the movement is happening here. So that's an extrinsic muscle. So in an extrinsic muscle, the origin is in the forearm, but the movement is in the hand. Okay, so that's the difference between an extrinsic and intrinsic muscle. Okay, now let's look at the structure of a muscle. So you have, oh, sorry, the parts of a muscle, not the structure. We learned the structure. Now we're looking at the parts. So you can see that there are three parts. There's an origin, there's an insertion, and there's a belly. What's the difference between origin and insertion? Anybody? Origin means it's the stationary point where a muscle attaches. So that means that part is not moving. It's a stationary, it's an anchor point. Let's put it into simple language. It's an anchor point. So when you have an anchor point, the anchor should not move, right? So you want to climb somewhere with a rope, you fix the rope somewhere, and then you're climbing, the anchor point should not move. That is the origin of a muscle. And the insertion is the mobile end. So the bony attachment at the mobile end of the muscle, that's where the movement happens. So that's the moving part. So that's the insertion. So the origin is the anchor, insertion is the moving part. And what's the belly? The middle part between the origin and the insertion. That's the thick middle part. So this muscle here, probably this is this probably is the let's say it's a biceps. So it has got two heads. That's why it's called. Why is it called biceps? Bi means two. Tri means three. So biceps is two origins. Okay. So this is the origin, no movement. This is the insertion. There is movement here. And in between, you have the belly. That brings us to four functional groups of muscles. So you have for any movement, there's a prime mover or the agonist. Agonist is a muscle which primarily makes that particular movement. So for say, for example, biceps is the prime flexor of the elbow. So you have the biceps here, that's a prime mover. And there's another muscle called the synergist, which assists the prime mover. So they also help in the same function, but they are a kind of an assistant. So they are the synergist muscles. They assist the prime mover. And then you have the antagonist. Antagonist is the muscle that opposes the prime mover. So for the biceps, what is the antagonist? Triceps, correct. So there is a agonist, there's an antagonist. And then there's another muscle called the fixator. This is a muscle which stabilizes the bone. For example, you have a shoulder blade. Here, everybody has a shoulder blade. This is a shoulder blade here. That has got a lot of muscle attachments, which moves your arms. And if this shoulder blade is not fixed, that will not give a strong support for the muscles. So that is the fixator muscle. And the rhomboids, the rhomboid major and rhomboid minor are two muscles that fixes the shoulder blades of the scapula. Okay, now two more words. Innervation. What do you mean by innervation? What is muscle innervation? Correct. No, well, it is contracting, but innervation simply means the nerve supply. It refers to the nerve that stimulates the muscle. So if I ask you a question, which is the innervation for the biceps? Means which is the nerve that supplies. So the medical term for a nerve supplying is called innervation. Okay. So that's, if you hear the word innervation, that refers to the nerve supply. Another word is another important concept is the blood supply. Does muscles need a lot of blood? Yes? No? What's your, you can be wrong, that's okay. They need a lot. Why would you say so? Yeah, they can become very active, right? But if you think about muscles, they are very demanding. They are metabolically demanding, a high demand. Normally, when you're not doing any exercise, 1/4 of your cardiac output, so the heart is pumping about 5 liters every minute, 1/5 of it is going into muscles. But when you're exercising, that goes even higher. About 3/4 of your cardiac output goes into muscles. So why do you need all this blood supply? Muscles need nutrients. A lot of waste is produced. They all have to be removed. So that means there's a lot of metabolism happening there. It's metabolically active. So they have a lot of blood supply. So the blood vessels, there are arteries. Okay, the arteries branch and become capillaries. And the capillaries come together and forms the vein. So there's an artery coming, breaking into these capillaries. The capillary supplies all the areas inside the muscle. And then from there, they all join together, form the vein, and the good blood comes in, and the blood with all the waste goes out, back to the heart, back to the lungs, gets reoxygenated, comes back again. All right. So it has got a very extensive blood supply. Now we're going to look at the different muscles. So you have muscles in the head, and the muscles in the head or the face is called muscles of facial expression. So you're talking about what all muscles? What are the faces you can make? I've shown you some faces. So there are muscles in the forehead, the muscles around the eye, muscles around the nose, around the mouth. When you're smiling, which muscles are working? The cheek muscles, right? When you're grinning, The muscles in the neck, these are all the facial muscles. So when I am talking or when I'm smiling, why is the skin moving? Because muscles are attached to bone, right? But here, muscles are attached to the skin. Where in the skin? The subcutaneous layer, yeah. So not the epidermis, to the dermis and the, yeah, hypodermis. That's where the muscles are attached. Especially the muscles in the face, these muscles are called muscles of facial expression. And it's very important. So you understand what a person's emotions are by just looking at them. And it happens because the muscles are attached to the deeper layers of the skin. And what is it? Innervation. What do you mean by innervation? Nerve supply. There is one nerve dedicated for that. And that's called the facial nerve. It's a cranial nerve number 7. That's called the facial nerve. They supply the muscles of facial expression. So these are all the muscles here of facial expression. And let's talk a little bit about the tongue muscles. How do you know whether a muscle is a tongue muscle? You can know it from the name itself because it'll have a word called glossus. So there are genioglossus, hyoglossus, all these, anything that ends with the nerve, with the word glossus means it's a tongue muscle. Why do you need muscles in the tongue? Don't you think it's a nuisance? For what? Yes, that is the swallowing process. But before that, what's happening? There's chewing happening, right? And your teeth are just hitting like this. So if the food is right in the middle, it won't be chewed. So the tongue has to move it to the chewing area. So the food will get chewed first. What is the scientific word for chewing? Mastication. Mastication has to happen. That's how the first process of digestion. Break down the food. So that's happening in the mouth by the teeth. So the teeth breaks it down, but the tongue is important. The food has to be moved into that biting space. So that happens by the tongue, pushes the food between the teeth, which is the strongest teeth which causes chewing. The molars, yeah. The molars is the chewing power. And then after that, we are going to go into what Jenna said, the swallowing part. So how does that happen, the swallowing? Because there are muscles around the throat, which is like a funnel. So after chewing, it's pushed into that funnel. And does it stay there? No, it goes down. How does it go down? Gravity will not pull it down because it's like a closed tube. But this tube again has got smooth muscles, and we have that process called peristalsis. So one part will relax, receive the food, and then that part will contract, push the food down, and the part which receives the food is relaxed, it receives it, pushes it down. So that wave happens. And that's how food passes down. So from from the pharynx, it goes through the esophagus, reaches the stomach. From the stomach, where does it go? Small intestine. From the small intestine, it goes to the large intestine. And from the large intestine, it goes into the rectum and then the anus, and it is pushed out. Well, not the food. In between, all the nutrients are absorbed in the stomach. And we learned all that in the lab. We saw all the cells which will absorb all the nutrients. And that's the reason why we were studying all those things at that stage. So today we were we are looking at the muscles, so we won't go into that today. Back to the chewing part. What are the muscles involved in chewing or mastication? 4 muscles you have to know, and you can see them. You have this muscle here, which you can see, which is called the temporalis. You can see this muscle here. Actually, this muscle you can feel. Just put your finger on your cheek and clench your teeth together. Do you feel something coming out? Put it over here and clench. You feel a band of muscle there when you clench? Which muscle is that? The masseter. Masseter. Okay, that's the masseter muscle. So this is the masseter muscle which I'm touching now. And over here, put your hand there and clench. You see a muscle clenching there? That is the temporalis. Then there are 2 muscles inside which you can't feel. That's a medial pterygoid. This is a medial pterygoid, and this is a lateral pterygoid. You can't see that, or you can't feel that. That's inside. So we talked about swallowing, and there are 3 pairs of muscles involved. They're called the constrictor muscles. It makes sense, right? Because there's a lot of constriction is happening there. And to move the foot down. So there's a superior constrictor, there's a middle constrictor, and there's an inferior constrictor. So they sequentially contract and moves food, and then the food goes into the esophagus, and from there it goes into the stomach. Okay, let's look at the muscles that move the head. So there are a lot of muscles in the head which causes movement. What are the movements of the head? Now we have to start thinking about the movements. What are the movements of the head? So you have a rotation. Okay, I agree. What else? What is this movement called? It's your bending. Yeah. What's the scientific name for that? Flexion. So it's flexion. And what is this movement? Again, you're moving towards your shoulder. Lateral flexion. Okay? And what is this movement? Looking up like this. Extension. Okay, so flexion, extension, lateral flexion, and rotation. Okay, let's move down into respiration. What are the movements there? You have inspiration and expiration. What happened? What is the main muscle for breathing? No, lung is something. Lung is an organ. It's not a muscle. Okay. The muscle, it happened, the lung will expand because the muscles are causing some changes there in the air pressure. I'll talk about that. So the main muscle for breathing is the diaphragm. Okay? And what kind of a muscle is that? It's a dome-shaped muscle. So the diaphragm is a muscle which really which is a border between the thoracic cavity and the abdominal cavity. Okay, so you have this dome-shaped muscle, and when it contracts, so the dome is like this. When it contracts, it goes down. Then what happens? The cavity becomes big, right? The thoracic cavity becomes big. So the pressure inside, it goes into negative pressure. So in order to combat that, air will enter into the lungs. So air enter into the lungs when the diaphragm is contracting. And when the muscle is relaxed, air will go out because the space is now decreased. The excess air has to be pushed out. So the air will go out, and what do we call that? Expiration. So you have inspiration and you have expiration. So breathing has got two parts, inspiration, expiration. What happens during inspiration? The diaphragm, what does it do? It contracts because it's a dome-shaped muscle. It contracts. So the cavity it becomes big, and negative pressure is created. Air enters through the lungs. Again, we have another two muscles, intercostal muscles. These are intercostal. What does costal mean? Cartilage, yeah, but what does costal mean? Costal, yeah, you're right. Costal, there's a connection with cartilage also, good. But costal means ribs. So costal, intercostal means between the ribs. So these are the muscles here between the ribs. So there are external intercostal, which pulls or elevates the ribs, and the internal intercostal, which lowers the ribs. So if you imagine the ribs like a bucket handle, so you have a bucket, it has got a handle, so the ribs are the bucket handle. So the external intercostal will pull the handle up, or the ribs up. When it comes up, the volume increases. Negative pressure is created. Air enters the lungs. And when it goes down, the volume decreases, the pressure increases, air is pushed out of the lungs. So external intercostal causes inflow of air, which is called inspiration. And external intercostal will elevate the ribs, and that will expand the thoracic cavity, and that will cause inspiration. Internal intercostal acts in the opposite way. It causes expiration. Let's move down into the abdomen. So we all know about the rectus muscles, okay? And this is the muscles here right in front. What does it cause? The bending. What is bending called? Flexion, okay? So it causes forward bending or flexion. And what is the joint here? The hip joint, right? The waist. So at the waist, you have, that's the axis, and you're bending down, and that's called flexion. So the muscle which produces the flexion is called the rectus muscle. And this is the muscle which has got there are three transverse tendons there. You have one tendon here, and one tendon here. But usually many people have a lot of fat there, so you don't see the tendon. That's why people go to the gym and they work out and they get rid of the fat and they create all the six packs and they walk around very happily. So that is what we call the six pack. Okay. So young men, and females, they impress each other with the six packs. Okay. Any other muscles in the abdomen? Yes. There's another three muscles there. There's an external oblique muscle, which is the outermost muscle in the abdomen. So what do? They actually cause flexion and they cause rotation. That is the external oblique muscle. And there's a muscle inside that, which is called the internal oblique muscle. So we are looking at three layers: external oblique, internal oblique, and there's another layer inside. So talking about the external oblique, it causes flexion. Internal oblique also causes flexion and rotation. And the deepest layer of muscle is called the transverse abdominal muscle. So what does that do? that is actually a muscle which is running like this in this direction. Okay, so when you say cheese for a picture, what do? You hold your tummy, right? That's your transverse abdominal muscle. So that's the cheese muscle. All right, let's move into a clinical condition. Hernia. What is a hernia? Hernia is a condition where there's a weak spot in the abdominal wall, or mainly the abdominal wall is muscles, right? There's all these, the rectus muscle, and there's all these oblique muscles. They're all muscles. But when there's a weak, and they hold all the internal organs inside. What do you call the internal organs? Viscera. Okay? So the viscera are the internal organs. When there's a weak point in the viscera, these internal organs or the viscera will protrude out. And that's what we call a hernia. So you can have different types of hernia. You can have an hernia where the most common type is called the inguinal hernia. And if you have inguinal hernia, the viscera can enter into the inguinal canal, which is a canal in your in the genital area, and in males it can even enter into the scrotum. So there will be, and this is called herniation, which means movement of the internal organs or the viscera into another space. That's called herniation. Let's go into the muscles of the back. So the muscles of the back, again, is causing. If the muscles in the front is causing flexion, the muscles of the back causes extension. But there's some rotation. There's also some lateral flexion, all these happening. Okay, so these are the muscles of the back. And let's quickly look at the superficial. What is the most superficial muscles in the back? So you have a big muscle here. This is called the trapezius. So a lot of, if you go for this bodybuilding, the judge will say, show the trapezius. And they will do something and they will bring out that muscle, so the trapezius will be shown. Or they will say, show this particular muscle. And then they will show the triceps or the biceps. That's how and the judges will evaluate, is it good or bad? They'll give points. That's how they do this bodybuilding competition. So trapezius is one of the important muscles here. It's a very big muscle here. This huge muscle here is the trapezius. And then you have what is called the lats, latissimus dorsi. So this is the lats. So these two big muscles are the superficial muscles. Then you have the deep muscles, which silently does the work. So the reason why I'm standing up straight is because the muscles in the back are compensating with the flexor muscles in the front. So they are all working together, and that's why you're keeping erect. So what are the muscles of the back? There's the erectus spinae muscles. So these muscles here, which you see, is called the erectus spinae. There are three muscles, spinalis, longissimus, and iliocostalis. And then on the other side, you can see there's a muscle deeper to that called the semispinalis thoracis, and there's a quadratus lumborum, and there is multifidus. So these are the deep muscles in the back. And these are the quiet muscles which are important for posture, stabilizing the spine, and they are all attached to the spine, and they, give you your balance. Let's move down into the pelvic outlet. We talked about the pelvis in our lab. We said there's a pelvic inlet and there's a pelvic outlet, right? In females, it's much more wider. In males, it's narrower, right? Why? Childbirth. Okay. So how does it hold everything? Now there's a lot of contents in the pelvic cavity. They're all held together by some fascia, but there are muscles also there. And this part here has got two triangles. You have a urogenital triangle, which is this triangle here in the front, and then you have an anal triangle, which is in the back. Okay, so this is a female view, and you can see there is a sphincter here, and there's a sphincter here, and the same thing here in the males. There is a sphincter here, and there's a sphincter here. One sphincter in the urogenital triangle. What is that sphincter for? That is a sphincter muscle to control your urinary passage. And if you lose that, you'll have urinary incontinence. What do you mean by incontinence? Which means you don't have control over your urine passage. Okay. So if somebody loses their control over passing urine, you say they are incontinent. Okay. So urinary continence. And then there's fecal continence, which means your anal sphincter will control that passage. And that's why you're able to hold your, your feces. And then you can relax whenever you want to go relax it. When you go to the toilet, you relax it. And then, so the brain has got some input there. We'll study all that. We're going to talk a lot about that control later. But for the time being, we are concentrating on muscles. So there are sphincter muscles in the urogenital triangle, and there are sphincter muscles in the anal triangle. So moving into let's go into the shoulder, and then we'll go to the upper limb, and then we'll go to the lower limb. So in the upper limb, you have muscles that move the shoulder, and the main muscle that moves the shoulder is the pec major. This big muscle here in the chest, that is the pectoralis major muscle. We said that that's a triangular muscle here. It's a big muscle. What does it do? It flexes, and also it adducts. So now I want you to know the movements of the shoulder. So what is flexion of the shoulder, of the arm? This is flexion. When you move the arm forward and upward, this is called flexion. Okay? So this movement is flexion. And what is extension? The opposite. This is extension. Okay? In the arm, it's slightly different. The other ones are much easier. But in the arm, you have to know this is flexion, and the opposite of that is extension. Okay, abduction. What do you mean by, let's say, abduction? So it's written abduction, but for you to understand, let's say abduction, okay? What do you mean by abduction? Means away, moving the arms away from the body. And adduction, moving the arms towards the body, okay? And then you have two other movements, external rotation. External rotation means if you put your arm like this and you move it out, that is called external rotation. And internal rotation is the opposite. Okay, so external rotation, internal rotation, abduction, adduction, flexion, and extension. So these are the four movements. I'm sorry, the six movements. Okay, and the pectoralis major plays a big role there. It flexes and adducts the body, the arm. Latissimus dorsi is a back muscle that moves the shoulder. Can you believe that? The latissimus dorsi moves the shoulder. It's a muscle over here. This is a latissimus dorsi, but it's got a major impact on the shoulder. It's an extrinsic muscle. The action is on the shoulder. What does it do? It extends, adducts, and medially rotates the arm. Now, let's look at some of the shoulder muscles. There are 7 shoulder muscles, which you'll be seeing in the lab, and but I want to give you the theory part now. So when you're in the lab, it'll make your life much easier. The important muscle in the shoulder, the first thing is that big muscle here. What do you call this big muscle here? It's called the shoulder cap muscle or the deltoid. Okay. So that's the deltoid muscle. What does it do? It is like this. It pulls the arm away from your body. So what does it do? Abduction. Okay. Then there is a muscle called teres major. So here you can see this is a teres major here. What does it do? It medially rotates the arm. So it brings it towards the body, medial rotation. And it also has a role in extension of the arm. Teres minor, lateral rotation. And then there are 4 rotator cuff muscles. You must have heard somebody had a rotator cuff injury. Yeah, that's very common. So what happens there, I told you about this joint here. What is this joint here called? The glenohumeral joint, because there's a glenoid fossa in the scapula, and the head of the humerus fits into it. And I told you it's a narrow or shallow joint, which means you have a lot of movement, but it can easily dislocate. So that's why the shoulder dislocation is very common. So it is a very shallow joint. So the head of the humerus fits into it. It's okay, but it's not very stable. So how do you make it stable? There are some muscles with tendons which is surrounding this particular joint. They are called the rotator cuff muscles. They protect or they keep that joint stable. They stabilize the glenohumeral joint. So these rotator cuff muscles can be, the acronym is called SITS. If you remember SITS, S-I-T-S, which means there's a muscle called S, supraspinatus, infraspinatus, teres minor, and subscapularis. So here you can see the supraspinatus. Supraspinatus means it's above the spine. Infraspinatus means it's below the spine. Teres minor and subscapularis. Okay, let's move into the muscles that move the elbow joint, which means it moves the forearm, right? So this part is called the brachium. This is called the antebrachium. Okay, so you have, let's just call it the arm, the forearm. This is the forearm, and let's call this the arm. Okay, so flexion. What are the movements here in the arm at the elbow? Flexion, extension. Any other movements? Pronation. Yes, there's a movement. What is pronation? Pronation, there is a movement like this. This is called pronation. And then the opposite of that is called supination. So you have extension, flexion, extension. This is supination and pronation. Okay, these are the 4 movements you need to know. And the muscles acting for extension, which is the main muscle, extending the triceps. The triceps is the prime extensor, okay? And if you're in anatomical position, you'll see that's in the posterior compartment. The posterior compartment causes extension. And there's a helper muscle. What do you call a helper muscle? The main muscle is called the prime mover, and the helper is called the synergistic muscle or synergistic extensor. And there's a muscle there called anconeus, which is the synergistic extensor. What about the flexion? How does the elbow flexion happens? That's this movement. Mainly by the, actually biceps is not the prime flexor. There's a muscle under the biceps called the brachialis. That is a prime flexor. Biceps is a synergistic flexor, but it's one of the powerful muscles. And there's another synergistic flexor called brachioradial. That's the muscle here. It's not, it's actually an extrinsic muscle. It's the biceps is here, the brachialis is here under the biceps, but the brachioradialis is here. It also causes flexion. Okay, that's a typical example for a extrinsic muscle. These two are intrinsic muscles. Okay, we said intrinsic muscle means it's inside that area where the movement happens. Extrinsic muscle means it's outside that area, but it causes movement here. Right? So it's all coming together. Okay. And we said there are two movements. One is called supination and one is called pronation. Pronation, there are two muscles, pronator quadratus, that's the main prime muscle for pronation, and there's another muscle called pronator teres. So two muscles causing pronation. And supinator, it's very easy, there's only one muscle. It's called the supinator muscle. So you have one supinator and two pronators. Okay, so now we are going to move. We were in the above the elbow. Now we're going to move down into the forearm. Now the forearm muscles. So, and what are the two bones in the forearm? Radius and ulna. Okay, so the radius is where? Thumb or pinky? Thumb. Ulna is the pinky, right? Okay. So let's say if there are muscles in the which is causing flexion, let's call it flexors. Okay? So we're going to call this muscle, which is on the radial side, we're going to call it flexor radialis, which means it is in the flexor compartment or the anterior compartment. It is causing flexion, right? And it is on the thumb side. So that's, and we are adding one word here, carpi. So flexor carpi radialis. It's easy, right? Yeah. And then on the pinky side, we have another muscle, same name, flexor carpi ulnaris. Okay? In between, we have some flexors which is causing the digits to move. We're going to call that flexor digitorum. Okay? And then there's one muscle which I don't have anything to help you, just think it's the weird muscle. It's called the palmaris longus. So these are the four flexor muscles in the forearm. Okay, let's look at the extensor muscle. Where are they? In the posterior compartment. So the flexors are in the anterior compartment, causing flexion. The extensors are in the posterior compartment, causing extension. Again, you have a extensor radialis, which means it's on the thumb side. You have a extensor ulnaris, which means it is on the pinky side. So one is here, one is here, right? Does it all make sense? Is it making it easy? I know there's a lot of words coming, but I'm trying to make it easy for you to remember these things, okay? So remember, there are two extensor carpi radialis. One is a longus, one is a brevis. Brevis means it's smaller. Longus means it is bigger, okay? And then there's an extensor, it's smaller. Longus means it's bigger. And then there's an extensor digitorum, just like the flexor digitorum. There's an extensor digitorum. And we said there's an extensor carpi ulnaris. Okay? It'll all make sense, okay? Just listen to this lecture a few times. This will help you a lot in the practicals, because when you're learning muscles, I know you'll become a little disoriented. So this will all make sense. Okay. Okay. Carpal tunnel. Everybody has heard about this problem called carpal tunnel syndrome. What is a carpal tunnel? Carpal tunnel is a space between the wrist bones. Okay, we have the wrist bones here. What are they called? The carpal bones. Between the carpal bones and a sheet called the flexor retinaculum. So here we have the flexor retinaculum. So this is like a bracelet, and inside you have the bone. So imagine there are bones inside and there's a bracelet out of it, outside it, surrounding it. Okay? Now, through this, there's a space there between the bone and this bracelet, and through that space passes all the tendons. These are the muscles which move the arm. Okay. And these tendons have got coverings. They have sheaths. And the tendon sheaths, these sheaths help the movement. So the smooth movement of the arms is because you have all these tendons passing through and they have sheaths, and it makes the movement very smooth. Okay. So far, are you with me? Yeah. Okay. So what happens in a carpal tunnel syndrome, in the disease? Here, there is prolonged, repetitive movement of the wrist and fingers. When do you do all these movements? Mainly when you're typing, right? Or, a lot of movement of the wrist, whatever you're doing. Okay? So these tendons can become inflamed. And you have to remember, they're passing through a tight space. The space is between the wrist bones and that bracelet. That bracelet is called flexor retinaculum. Okay? So when the tendons become inflamed, what's the first sign of inflammation? When you have an inflammation of your hand, first sign is that it becomes redness. That's the first sign. You get a bruise, the first thing is redness, right? And then swelling. So swelling is a sign of inflammation. So when it's inflamed, it becomes swollen. It becomes big. So this is a tight space. So the tendons are inflamed. They have become big, and there's a nerve passing through. That nerve is called the median nerve. So when these tendons get inflamed and when they become big, the nerve is inside, the nerve is compressed. So when the nerve is compressed due to pressure on the nerve from the inflamed tissue, then that nerve causes some pain, some tingling, and this is what we call carpal tunnel syndrome. So actually, it is a problem with the median nerve. The nerve is compressed, and then it ends up with some tingling and numbness. Sometimes the pain can even radiate to the shoulder. And what's the treatment for it? If you have an inflamed area, you give an anti-inflammatory drug, right? Or you can immobilize the joint. You can see these people have special braces which keeps them in a particular position to give rest. So you give rest, you give anti-inflammatory drugs, and sometimes you need surgery. Surgery for what? What can you do there? Surgery is like carpentry, right? You're doing that for a purpose. You have an inflamed appendix, you remove it, we call it appendicectomy, but it's carpentry. So what kind of carpentry can you do there? You can cut that bracelet, right? Because we said it's a tight space. So you have bone inside, you have this bracelet on the outside. You can just cut this bracelet, open it, pressure is released. So that is the surgery to release the pressure on the nerve. So in extreme cases, we can do that. And usually it's done on this side. And I told you, some surgeons, they would use these lines. You know, we have these natural creases in the skin. So if you put a cut here, you always put it like this because it'll go into the crease. So when you're moving around, people won't see that scar, right? You put a cut here, open it, and cut that flexor retinaculum. That opens up, pressure is relieved. So that's a surgery. Actually, it's a very simple surgery. Okay, so let's move down to the legs. So what's the leg here? You have the hip joint. So the movement is happening here at the hip. What are the movements? Basically, you can move the thigh up like this. What is this called? Flexion of the hip, right? So you have flexion of the hip where the knee is coming to the chest. And this is caused by two major muscles. One is called the iliacus. This is called the iliacus muscles. This one here, this big one here, which is attached to the hip bone. And then you have another muscle here called the psoas. Together, it's called the iliopsoas because even though they are two muscles, the actions are together. They come together and they are like one single muscle. So it's called the iliopsoas. So iliacus and psoas together causes hip flexion. Now, extension. Hip extension means, what is a hip extension? When you're climbing a staircase, so you put your leg on the next stair, you move up, you're going up like this, that is hip extension, right? So you're going up. That lift, which is happening, is caused by your gluteus muscles. Okay, so the muscles on your bum, on your buttock, they are the gluteal muscles. And you have three gluteus muscles. Gluteus maximus. What does maximus mean? The big one, the biggest one. Medius means smaller than that. And minimus. So gluteus maximus, medius, and minimus. So here you can see the gluteus maximus. Move this guy. So here you have the gluteus maximus, medius, and you have if you remove the medius, inside you have the minimus. Okay? That's the muscle which gives you the lift when you're going up a stair. Yeah. Okay. Now, if you go to the gym, you can see people doing this kind of an exercise, right? What is that called? You're bringing the thighs together. So what is it? Towards the midline. Not abduction, opposite. Adduction. Yeah. Adduction. Adduction. Okay. Let's use the word adduction. So when you can understand it properly. Okay. So adduction. And that means you're squeezing the legs together. Okay, and this includes 5 adductors. These muscles are called adductor muscles. So you have pectineus, and then you have adductor magnus, adductor brevis, adductor longus, and gracilis. So here you can see this is a pectineus, adductor magnus, adductor brevis, longus, and gracilis. You'll see all this in the lab. And you'll be quizzed on it also. So that'll all be in your exam. So you'll be seeing all these muscles. So I'm just giving you a heads up now. So what are you going to see in the lab? Okay, when you go to the gym, again, you see people doing this kind of an exercise. Where is the muscle power coming from? It's coming from, so you're moving it up. And then when you're moving it up, you can feel the muscle in the thigh, anterior thigh, are contracting. They're tense. What are they? These muscles called? Quads. The quads, quadriceps femoris group of muscle, otherwise called the quads. So there are 4 muscles here. The muscle in the middle, or the main muscle, this one is called the rectus femoris. This is a rectus femoris. And then there are 3 vastus. There's a vastus lateralis, vastus medialis, and vastus intermedius. So vastus lateralis is on the lateral side, medialis is on the medial side. Medial mean lateral, medial, right? You know that, right? Lateral is on the outside, medial is on the inside. Okay, so you have, and the intermedius means it's in the middle. Actually, the intermedius is right under the rectus femoris. Okay. Posterior thigh. So somebody is in the gym here and he's doing this movement. Which muscle is contracting here? The muscles in the posterior thigh. And this muscle is called the hamstring muscle. 3 hamstring muscles you have to know. You have the biceps femoris. So this is the biceps femoris. And next to the biceps femoris, you have the semitendinosus. And then you have the semimembraniosus. I'll make some videos for the lab and I'll post it on YouTube so you can, watch it. And I have a lot of help to make these videos this year. So we'll make some videos and put it up. So feel free, anybody, it's on YouTube. So everybody can watch it and use it. Okay, muscles acting on the foot. What are the muscles acting on? What are the movements of the foot? So you have this movement of the foot is going up. What is that? It's flexion, but we call it dorsiflexion. Okay, the opposite is plantar flexion. So you have dorsiflexion and plantar. So dorsiflexion is lifting the foot upward. And where are the muscles causing dorsiflexion? They are the muscles in the anterior compartment of the leg. Okay, the main muscle is the tibialis anterior. That is a muscle, which is a bone there. Tib and fib, tibia and fibula, right? 2 bones. Tibialis anterior, the muscle in front of the tibialis. Very simple. Then there is a muscle on the side, which is, this is where the fibula is, fibularis longus. It's also got another name called peroneus. And then you have some muscles just like the hand. In the hand, you have the flexor digitorum, extensor digitorum. Same thing here. You have the extensor digitorum. And then you have muscles attached to the big toe. Anything attached to the big toe is called hallucis. Hallucis means big toe. So you have a extensor, hallucis, longus. And then you have muscles, let me move this. Muscles, which is causing plantar flexion. The other one is called, this one here, when the leg moves up, it's called dorsiflexion, down, plantar flexion. It's not extension. It's called plantar flexion, which means you're standing on your tiptoe. Okay? So when you're getting a picture done, you're at the back row and you're not tall enough, what do? You go up like that, right? So that you're in the picture. So that is a plantar flexion. You're standing on your tippy toe. So which muscles causes the plantar flexion? The calf muscles. What are the calf muscles? There is a big muscle here. There's only one big muscle here that is called the gastrocnemius. So gastrocnemius has got two heads. There is a medial head and there is a lateral head. So this is the gastrocnemius. That is what causes the plantar flexion. Okay. And then there's a tendon which attaches that to the calcaneum or the heel bone. Okay. And that tendon is called the Achilles tendon. So Achilles tendon is sometimes gets inflamed and you can get a Achilles tendinitis. And if you remove the gastrocnemius muscle underneath, so I've cut the gastrocnemius muscle, underneath there's another muscle, soleus. So these are the two muscles which causes plantar flexion. Oh, we're finished. We got all the muscles done today. That's wonderful. All right. Any questions?